Hi, my name is Brenda Barrow. I've been a dental assistant at the Department of Veterans Affairs in El Paso, Texas for over 8 years. I've assisted our VA dentists caring for thousands of veteran patients during that time, several who suffer from different stages of gum disease. I'm here today to educate you and enlighten you about gum disease. Gum disease is a bacterial infection which the World Health Organization estimates affects 1 in 4 adults in some form, with 15 to 20% of adults developing the severe version of this disease. According to the American Dental Association, it is estimated that only about 10% of adults who have gum disease are even aware of it. You're probably wondering exactly what gum disease is. Gum disease is a bacterial infection which begins as gingivitis, and if it's left unattended and untreated, it will progress to periodontal disease. Periodontal disease can become devastating for a dental patient. This is because it often will lead to the dental patient losing teeth at an alarming rate. So what exactly is gum disease, you're wondering? Well, our mouths are full of bacteria. Everyone has it. These bacteria, along with mucus and other particles, constantly form a sticky, colorless plaque on teeth. Brushing and flossing help to get rid of this plaque. But plaque that isn't removed will harden and form what's called tartar. Tartar cannot be removed by flossing or brushing. Only a professional cleaning by a dental hygienist or a dentist can remove this tartar. The longer plaque and tartar stay on the teeth, the more harmful they are. The bacteria cause inflammation of the gums, which is called gingivitis. In gingivitis, the gums become red and swollen and bleed easily. If you have gingivitis, you can very easily visually see that you have gingivitis. If you look in a mirror and just open your mouth, you'll feel as well as be able to see that your gums are red and puffy and are very sensitive. Your gums may also bleed a bit when you brush your teeth and floss. If you have these symptoms, you'll most likely make an appointment to see your dentist to tell him your whole mouth hurts and you aren't quite sure why. As soon as a dentist or a dental assistant or a dental hygienist looks in your mouth, it'll be very obvious if you have gingivitis. Gum disease also is very apparent on x-rays. Personally, as your friendly and always helpful dental assistant, when I have a patient who comes in on an emergency basis with red swollen gums, stating that his whole mouth hurts, I'll then ask him how often does he really floss. Quite often I can already see a whole bunch of food stuck in between his teeth, just as I'm sitting there talking to him. 9 times out of 10, the patient will confide in me that he either doesn't floss at all or maybe does it once in a while, maybe once in a month. I advise them of how very important it is to floss, and also, very nicely of course, point out to him that when he doesn't floss, that all of that food that should be flossed out from between his teeth every time after he eats is still stuck there, and I can see it. I'll then discuss how all of that old food stuck in his mouth, along with the bacteria which accompanies it, will also be giving him bad breath. Gosh, nobody wants to have bad breath. That's just gross. The dentist will then come in and he's going to greet the patient. When this patient goes in to find out from the dentist exactly what's wrong with him with his bad breath and his red swollen gums and bleeding every time he tries to floss or brush. So the dentist is going to come in and greet the patient. He'll ask the patient what's bothering him and then tell him to open his mouth so he can take a look. After noticing visible symptoms inside the patient's mouth, the dentist will then explain how gingivitis is a mild form of gum disease that most often can be reversed by just brushing and flossing the correct way daily and having cleaning done regularly by a dentist or a dental hygienist. This stage of gum disease is known as gingivitis, does not include any loss of bone and tissue that actually hold your teeth in place. But if gingivitis is left untreated, it will advance to periodontitis, and this is really bad. The dental term periodontitis means inflammation around the tooth. When periodontitis occurs, the gums literally pull away from the teeth, forming what are called pockets. You might be sitting there wondering right now if you have pockets, and guess what? Everyone does. The important question is, what are your pocket numbers? Well, I'm going to tell you this now. If you listen closely at your next dental exam, this is how you'll know what your pocket numbers are in your own mouth. When you're having a dental exam, you'll hear your dentist tell the dental assistant who is charting your mouth in your dental chart that he wants to do perio charting. When the dentist does perio charting, He'll look in your mouth while poking around each tooth on different sides of each tooth, and it's probably going to hurt you a little bit. And he's going to be calling out a bunch of numbers for the assistant to chart. By doing this, your dentist is recording the pocket depths around each tooth in your mouth. Good numbers that you want to hear of what your pocket depths are should be between the numbers 1 to 3. If you hear higher numbers, beware and listen carefully. Those are the areas in your mouth that you need to especially brush and floss around a lot more than you currently are, if you want to keep those teeth and hopefully not eventually lose them. If you have teeth with a pocket depth of 4 or higher, those pockets are going to be infected. The body's immune system will fight the bacteria as the plaque spreads and grows below your gum line. This is called a receding gum line. When this happens, it will look as if the skin holding your tooth in place is actually coming loose. Often at this point, some of your teeth will be loose, either a little bit or maybe a whole lot. It may be all of your teeth that are affected by this or just a couple of teeth. This is because the bacterial toxins and the body's natural response to infection start to break down the bone and connective tissue that hold your teeth in place. At this advanced stage of periodontitis, if left untreated, the bones, gums, and tissue supporting the teeth are destroyed. Your teeth will become loose and they're going to have to be extracted. If you have periodontitis and need to go to a specialist to treat this for you, you will go to see what's called a periodontist. That's a periodontist. Your periodontist will have many x-rays taken of your mouth, and then he'll thoroughly assess your periodontal situation. He'll likely want to treat your periodontitis by performing gum surgery, along with having you schedule for specialized cleanings and treatments over approximately a year-long period. And it costs a real lot of money for this treatment also. The total periodontal treatment may cost about $9,000. And the whole time you have to be diligently flossing and brushing your teeth as well. So by now you're likely wondering, what are the known risk factors for getting gum disease? Well, smoking is the #1 risk factor. If a patient smokes, it also drastically lowers the chance for the successful treatment of gum disease. Diabetes is another known risk factor for getting gum disease because people who are diabetic are at a higher risk for developing infections. Persons who have AIDS or are being treated for cancer are also at a high risk for gum disease. Oftentimes, dental patients will have problems periodontally after they've had radiation treatment. Certain medications are also known risk factors for causing gum disease. These medications are ones that reduce the amount of saliva in a person's mouth. Saliva is real important for your dental health because it helps to keep your teeth strong. Right now you're probably wondering, what are your own chances of getting this periodontal disease? Well, people are usually diagnosed with periodontal disease in their 30s or 40s. Men are more likely than women to have gum disease. And although teenagers rarely develop periodontitis, they can develop gingivitis, which is the mild form of gum disease. In the end, to conclude, the best way to do your best to hopefully avoid getting gum disease is to floss and brush several times a day, every day. Don't skip. You should be brushing and flossing in the morning, and then at lunchtime after you eat lunch, after you have dinner, and of course before you go to bed. You should also be swishing with an antiseptic mouthwash at least once daily. And be sure to have your teeth cleaned twice a year at a dental office and have a yearly dental exam by a licensed dentist. Thank you so much and have a great day. Bye-bye.